All right, thanks for joining us all. Got a little Bucks talk in there. A couple hours away now from Game 5, so we'll see how they do tonight. Thank you for joining us again for our weekly Native Strong COVID-19 discussion on the COVID-19 pandemic in the Native community in Wisconsin and the Bemidji area. Of course, our featured speaker, featured guest, as always, Dr. Lyle Ignace of the Gerald L. Ignace Indian Health Center. Mark Denning, our usual moderator, week to week, is on a canoe somewhere, hopefully having fun out in the sun today. So wish him a great holiday weekend, and glad he got a good start on it. So with that, if you're joining us and have some questions, if you're joining us via Zoom, we can always drop in a comment or a question in our chat bubble just at the bottom of your screen. Move your cursor around, it should pop up. Drop a question in there. If you're joining us via Facebook Live, you can just drop in a comment there as well, or any other platforms that I may share it out to, Twitter or LinkedIn maybe. So with that, I'm just going to move along right away. We'll get us going here, and go Bucks. Thanks for joining us again, and here's Dr. Ignace. Thanks again, Dr. Ignace, for being here this many weeks, a year and a half in. So.
Yeah, it feels like yesterday when we first started this, and I'm kind of mad with Mark. He didn't invite me on his canoe trip, so it would have been nice to hang out up north, Wisconsin, on the northern waters, and what perfect weekend. So I have some new updates and things that will pertain to everyone coming up this weekend, and people are going to be getting together, having get-togethers and social events, and maybe these are going to be good talking points that you can bring up. So I know I've presented this topic before in myocarditis, and I'll go through this fairly quickly, but just as a quick reminder, myocarditis as a inflammation of the heart muscle itself can certainly cause concerns and a lot of clinical problems. But just as a highlight, the occurrence of this occurs predominantly after the second shot. There are cases after the first, but for the most part, it is occurring after the second dose, at least 3 to 4 days after the second dose. And chest pain seems to me the most common of symptoms. Now, what's interesting is the CDC is obviously looking into this, and at least presently, they know that they sense there's an association with vaccine to myocarditis, but they haven't yet identified the exact cause that links to the diagnosis. So that's still ongoing, and I suspect there will be several hypotheses that will be moving forward, and people are going to be coming out with articles and research on that as the months go by. But what is being seen is myocarditis is seen predominantly in individuals in their 20s. And males seem to be impacted more than females. And generally speaking, the older you get, the older the age groups, the less and less frequent this occurs. So we don't see this in individuals like essentially 50 years and older. There are some cases, but it's so rare. Myocarditis is rare to begin with, but it's even more rare for there to be any association linked with older age groups. So with that being said, let me get into at least the clinical presentations of myocarditis. I know I've gone through this before, but chest pain is, as mentioned, was the predominant cause. If progressive, severe enough, can certainly lead to an asynchronic movement of the heart muscles, and which can lead to shortness of breath. The shortness of breath is due to congestive heart failure. And this pressure buildup can build up back into someone's lungs, as well as pressure and fluid buildup in the legs, arms, and feet. So, and another predominant symptom is fatigue. So these are probably the primary. And just so you know, myocarditis tends to resolve on its own. As quick as it may come on, it may disappear in short order as well. So typically symptoms tend to last 24, 48 hours, and they kind of slowly go away. Much like how if you were to get a cold, it takes several days for it to ramp up to its kind of maximum symptoms, and then several days for it to resolve. And that is really much of the same kind of pattern that myocarditis has. So if it's diagnosed early, it can be treated quickly, and for the most part, people have no additional symptoms afterwards. So what I wanted to bring up as kind of as a main point to why I'm bringing back this topic, myocarditis, is that the CDC has come out and essentially said, yeah, warning, there is a risk for myocarditis. But this graph really shows that the benefits of getting vaccines outweighs the risk of getting myocarditis. So when you look at this graph here, this is really looking at mRNA vaccines. This includes Pfizer and Moderna. And really the cases of myocarditis associated by age group and what the vaccines can do in terms of prevention. So how you look at this is you can look at age groups, okay, young to old, and you can see that the cases of myocarditis dramatically go down with each growing age group, while at the same time, the association of hospital prevention dramatically goes up as age group goes up as well. So one way to look at this and say that for every 1 million vaccines among males aged 12 to 17, 1,700 COVID-19 cases will be prevented. 215 hospitalizations prevented and 2 deaths prevented. So that's looking at it from a prevention standpoint of the effects of COVID. On the flip side of this, you could look at it and say, well, for every 1 million vaccinations, there will be anywhere from 56 to 69 myocarditis cases. Now, the reason why this is significant and how it's displayed like how it is that there is an association, there is a risk of getting myocarditis, even though it may be very small. The benefits of getting vaccines, and not only its prevention of transmission, but also the prevention of fatalities and hospitalizations. And that's really the main point. And that's what the CDC is really trying to explain in this, is that the benefits of getting the vaccine far outweigh the risk of getting myocarditis. Another hot topic that is being talked about right now is booster shots. Now, presently, as of this moment, I'm being presented with this question quite often. Do we currently need a booster shot? And I think what the information is coming out right now, as of right now this week, is kind of a general sense of no, we don't need a booster shot. And the reason why that is because Pfizer and the mRNA vaccine is actually shown to be quite effective against not just the original virus, but all of the variants that have come out, and particularly the Delta, the most recent Delta variant out of India. So as long as there is the sense of and the backing the numbers that back this, is that the mRNA Pfizer vaccines have shown to be really, really effective. So that is good news. So will we need a booster shot? The evidence right now is we don't know. And when we talk about boosters, are we talking about the whole population, or are we talking about a subset of patients or individuals who are at the highest risk? And the reason why I say that is because we know that frontline care workers and nursing home residents, obviously there's always the direct in-person interactions that occur in frontline people who manage and care for individuals that have COVID. They're certainly at the highest risk of reinfection. What is also interesting now is information is coming out that individuals that are immunocompromised, and by that I mean individuals who have an autoimmune disease such as lupus or rheumatoid arthritis, and other states of health, like people who have cancer, who are undergoing chemotherapy, bone marrow transplant. These are the individuals that would be the most susceptible, and what's being found out is their immune response after getting the vaccine is not as good as someone who is not in an immune compromised state. And what I mean by that, so let's say for myself, after having gotten the vaccine, that my efficacy for prevention may be about anywhere from 90 to 95%. For someone of my age who may have underwent a bone marrow transplant, who got the vaccine, their immune response may not be as effective in preventing the vaccine, and may be as low as 40%. So that's pretty significant, and a pretty wide range difference between someone who may be of a normal health status versus someone who is immunocompromised. And these are the particular individuals that we may look more closely as needing a booster. But again, we don't know yet. As time will tell whether that's the case. Now, a lot of medical research and studies that are coming out, they'll be coming out late summer, early fall, so we'll know a lot more by end of August, September, how this is all going to pan out. Now, what is probably more clear indication of boosters and when this would occur would be whether or not there's evidence of declining protection against the illness. So basically, we're finding out, let's say, vaccines become more and more or less effective, and time of our antibody response starts to decrease. That would be certainly one indicator as to press for a booster. The other would be a variant, an escape variant being one that evades the vaccine and our immune response. So I think that was probably the biggest concern with this new variant. Was it going to be Delta, the one that's going to be the escape variant from the vaccines and our immune response? And the answer is actually no. So I'll bring this point up again because as I go through this discussion, an escape variant could very well be the igniter for and more discussion about boosters. So, but I'll keep folks up to date if that is the indication, or at least the direction that we're heading. Now, what's kind of interesting, if people live here in the southeastern part of Wisconsin, the Journal Sentinel, that's a local city paper, had come out with an article, and very specifically talking about the impact of vaccines on the health status related to COVID. And what they are reporting is nearly 95% of people who have died from vaccine between March 1st to June 24th were unvaccinated or not fully vaccinated individuals. And that's pretty telling because that's a very clear indication that not only are vaccines effective, but they could really prevent bad outcomes of fatality. And that's really the main point of the article that was coming out. Now, what is also interesting is that between January 1st to June 24th, only 1% of all confirmed or probable COVID fatalities were among those that were fully vaccinated. So, you know, unvaccinated to vaccinated, can it prevent disease? Can it prevent fatalities? And the answer is very clearly yes, without issue, it does prevent. Now, with the introduction of vaccines since its authorization, overall the case rates, hospitalization rates, the fatalities have dramatically gone down here in the state of Wisconsin. Now, what puts a twist in all of this, and I'm sure people have started to hear this, is, let me put this one up first. The Wisconsin DHA surveillance data has shown an uptick and a significant increase in non-COVID respiratory illnesses during the month of June. And this is specifically RSV, respiratory syncytial virus, parainfluenza, and seasonal coronavirus. Now, this is kind of a good segue here because we didn't, you know, we're well beyond the cold and flu season right now. We're way past that point. But what I wanted to bring up, and I'll bring up this slide again, is this was the seasonal pattern for cold viruses for the state of Wisconsin. So we had rhinovirus, adenovirus, and the coronavirus. Now, I may have presented this back in April, but as you can see, these numbers are extremely low, especially when you look at the October all the way to even February. The colds due to these viruses were almost non-existent. And so that is as of April 14th. Fast forward to this slide here. If you look at the date line here of March 10th, moving forward, you see those numbers starting to increase and increase. And over the last couple of weeks, or at least in the month of June, we see that coronavirus, parainfluenza, rhinoviruses, and adenoviruses are kind of leading these colds. Now, what's kind of interesting is that we've been under these protections and mitigations for getting COVID, which really translated in preventing a lot of things, a lot of other viruses that cause colds. And so back during the cold and flu season and coming out of, let's say, in March, I started looking at what the impact was the cold and flu on people living in Wisconsin. And as I mentioned, it was almost non-existent. Even for the flu, it was non-existent. Everything that we were doing to prevent COVID also helped prevent the cold and flu viruses. And my sense was either we're going to completely bypass this year of cold and flu, or we're just kicking the can down the road until these viruses reemerge. Well, I think we have a good indication here that we pretty much kicked the can down the road, and now we're seeing an uptick in all of these cold-related viruses. So it's going to kind of conflate COVID, the issue around COVID right now is because, is it COVID? Is it non-COVID? If it's non-COVID, what kind is it? And so this is kind of important, and not to concern individuals, but I did have the seasonal coronaviruses. Now I wanted to, this is the flu, which was pretty much non-existent during the regular flu seasons based on historical, but I wanted to remind people about coronaviruses. And so it's really a big genre of viruses that are seen both not only in humans, but also in animals. Now, we know that there are 7 strains of human coronaviruses that have been identified, and 4 of those strains are commonly found in Wisconsin. And these 4 common viruses are generally the seasonal coronaviruses, the seasonal viruses that cause colds, mild respiratory upper symptoms. And so, it's to differentiate what we currently know as COVID-19 and it's termed severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. That is COVID, and COVID-19 is the disease of SARS-CoV. But just not to belabor it, but it's just part of the 7 coronaviruses that we know that cause respiratory symptoms. So seasonal coronavirus are the 4 strains, not to be confused with COVID-19. All right. I wanted to bring this up, kind of give a quick update as to what's being seen worldwide regarding mRNA. So here in the highlighted area, the B.1.617 Delta, UK has come out with a paper indicating that the efficacy of Pfizer mRNA technology is about 79 to 92% effective after completing the series. And what's interesting is that it's 33% effective after the first dose. Now, that's not to say people should just get 1 dose. I'm not advocating that. They should get the full series. But what's kind of interesting here is that even though 33% doesn't sound a whole lot, that's actually not a bad response. But once you get the second shot, okay, once you get the second shot, then it goes up to that higher efficacy rate. And this is very specific to the Delta virus. And so that's important because we've all been wondering, and this is one of the indications as to why there's not a need for a booster at this time, because out of the UK, the mRNA Pfizer has been shown to be effective in preventing infection. And so, as I just mentioned, the study out of the UK, 88% effective efficacy 2 weeks after the second dose. First dose, 33%. Another analysis showed that 94% effectiveness against severe disease. So that's about severe disease being admitted to the hospital. After 1 dose, that's really good. 96 after the second one, just a little better. And that in a Scottish study showing that the vaccine was almost 80% effective in preventing hospitalization. So the information is starting to come out and starting to demonstrate how effective the mRNA technology vaccines are against the Delta variant. So that is actually good news and exactly what we want to see. Now, kind of giving an update as to what's going on here in Wisconsin with the variants. This upper table here, I'm going to be starting to list out the comparisons week by week by week, really showing kind of how this is developing here in Wisconsin. So, last week you see June 24th, Delta and Epsilon. Delta is the India variant. The B1427, the B1429, that's the California. That was a U.S. origin variant, and that is termed Epsilon from the WHO. So these are the two most significant ones because they've shown such a dramatic increase in the number of these variants. You know, the B117, yes, in the early beginning, it was the predominant. It still is. But what is now being introduced into Wisconsin is now Delta and Epsilon, or if you want to go by its original, the India variant, as well as the California variant. So these are two new variants that are starting to increase in predominance. And what's interesting is that these are tending to show up primarily in the northeast part of Wisconsin. Northeast being basically Brown County, Outagamie, Shawano, Menominee, in that upper northeast part of the state. And it's just kind of interesting to, you know, do people remember that back in November, October, November, when it came to cases, we were one of the hot spots in the country. And what was really, really significant was the northeast part of Wisconsin was the hottest spot in all of the country. And so now that that has calmed down, in its place, I guess, is a resurgence of the virus. And it's not of the original virus, it is now the original, it is now of the variant type that are really showing up in the northeast part of the country. So why that is, I don't live in the area. I don't see how the variant was introduced, but it is quite transmissible. So it's a particular interest going forward to see how this is, how the numbers are going to play out here in the next month. Just to give an update as to what's going on throughout the world. You know, here in the United States, the numbers are continually declining on a weekly basis. India has certainly shown this to be the case as well, although it looks like they may be plateauing and that may be more dependent on the vaccine rate than anything. What's interesting, what's occurring in Israel and the United Kingdom. Now, these were two countries that fastly approached their high vaccine rates. And what is of particular interest is, let's say in Israel, there were almost a good week, 2 weeks where there were no cases reported. And now we've had these kind of incidental days of bumps, and as of yesterday, there were 300 cases that occurred in Israel. So they may be heading into a bit of a spike here. Same with the United Kingdom. Prime Minister Boris Johnson came out a couple of weeks ago saying, hey, our data is indicating new cases are occurring, and as a result, they pushed back their restriction, the restrictions that they placed, they delayed that lifting until July 19th, and you can now see why they did that, and that's predominantly this surge that is occurring primarily due to the Delta variant. So much like what we saw in India with that large surge spike due to the Delta variant, we're now seeing that in the UK. And what's important to realize, and I mentioned this earlier, is that the vaccines are effective against the variants, in particular against the Delta variant. So the question now is, what's occurring in the United Kingdom, is this due because of not only the variant, but is it occurring in people who are vaccinated and unvaccinated? And the answer is that it's primarily occurring in people who are unvaccinated. So the UK has seen a bit of an uptick, and hopefully that is a small small spike and starts decreasing fairly quickly. So I wanted to present this because it's kind of two ways of showing the same thing but different models. On the left-hand side, we see the total population of single dose. For the state of Wisconsin, it's 50.2% right now. On the right-hand side, we see it's 61.2%. This is if we exclude the younger population and just include 18 years of age and older, we are at 61.2%. And here we see the demographics by age group and the rates of vaccination. As you can see on the left-hand side of the total population, you just see this kind of step down rate of vaccination with each decreasing age group. And this is going to be important, what I'll bring back later. So on the lower half of this slide is you see that in yellow, the ever decreasing number of individuals, of new individuals getting vaccines, and it's across the board with all, including all races and ethnicities. There's really been a decrease all the way around for not only age group, but also by race and ethnicity. This is looking at the rate of individuals by total population who've completed the series, 46.9, as well as 18 and older of 57.5. Looking as these as the benchmarks in comparison to what's going on in the U.S., Wisconsin is falling a little bit behind the U.S. numbers. So to date, 5.5 million doses have been administered. As of June 30th, we're averaging about 15,000 doses per day. If we look at what's occurring in the 12 to 15-year-olds, we see that 503 doses are given out on the average over the last 7 days, and that's steadily been declining since its introduction. And what's of a little interest is, as of this week, the adults that are getting the vaccine, 18 and older, has taken a slight bump up at 14,000. So maybe this is a new trend, but it's at least what's occurred here in Wisconsin. When we look at what's occurring throughout the United States, we don't see that a little uptick. It is kind of the steady decline that's been occurring since the beginning of April. So that hasn't changed. What is of concern to me, and if you look on the right-hand side, you see the averaging of 582,000 doses per day. And you can just see the steady decline of this occurring. And what's interesting is how the CDC calculates their average, their 7-day average is several days, kind of a several-day delay. This allows all the states to update all the data banks and allow the CDC to give a more accurate picture of the dosing. So there's a delay, at least a 4, maybe 5-day delay before they actually post what the true average actually is. But what I'm more concerned about is looking at what's occurring today or yesterday. Those new doses, that new mark of how many doses being given that day is steadily declining. So you see 582 doses per day, and you see the 246,000 new doses given as of like either yesterday or what would be given today. And that is something I've been observing for a good month now, and just noticed that the lead days, the today and yesterday, are steadily declining and coincide with whatever's occurring today or yesterday is a pretty good indication of where that average is heading. And so This is going to be steadily declining without question. Now, on the 23rd last week, I presented where this projection, where we kind of stand. Now, for us to reach that 70%, the total population single dose by July 4th, I projected that we would be about 54.8 or 54.5 in that range, and that we would have a shortfall of meeting that 70% by 48 million people. Now, based on how this is moving, it looks like we'll fall right in the middle of that projection by July 4th. Now, if we just look at adults 18 and older, the same day, July 4th, as the projection date, I projected that the rate would be about 66 to 67%, would be that rate, and that's based on the averages that were leading up to this, to July 4th, and that we would have a shortfall of about 8 million people. It looks like that's pretty close to where we're going to fall, maybe on the higher end, towards 67%. So, but again, it is a shortfall. And looking at what it would take for us to get to 70%, it will take us about 160 days for the total population to get to 70%, and that would put us past New Year's. If we're looking at just 18 and older, we're looking at about another 30 days. So perhaps the first or second week of August is kind of that time frame of when the U.S. Would get to that 70%. So, so time will tell, and given the rates, given another extra week, if these rates continue to decline more rapidly, that's where we will probably be. Just of note, I wanted to just show people where Wisconsin, Minnesota, Michigan are. They're ranked 30, 31, 32, and the number of cases in the last 7 days. So it's not very many, right around 600 cases over the last 7 days. So it's a lot better than the more than half of the states in the in the U.S. So these are steadily declining. These aren't wide fluctuations up and down. These are steadily declining. Not just us, but for all states are doing this. So this is a really good indication that things are really slowing down now. As everyone's familiar, I give updates as to what's going on in the native populations to our adjacent states. And of particular interest here is Michigan. The native population had an increase of 84 cases in the past week. Now, that's pretty striking because that goes against what the trend was doing for the last 6 weeks. Last week it was only 14, and then we have this dramatic spike in new cases. Why that is, it's hard to say. I would gather it's probably as a result of maybe an outbreak or two. I can't believe that it would be just of a general natural transmission here. There had to have been social gatherings that would allow spikes to occur this dramatically in such a short amount of time. But here in Wisconsin, there's only been 7 new cases in the past week. In Minnesota, there's only been 8. So Michigan shows a dramatic increase as well. Minnesota and Wisconsin has pretty much maintained this steady decline over time. So looking at the 7-day average here in the state of Wisconsin, the rate as of yesterday was 69, and we have not seen a 7-day average of 69 since March 21. That's what, 16 months ago. And really at the beginning of these numbers taking off here in the state of Wisconsin. So just to review where we are in terms of case rates, if we look at all ages by race and ethnicity, we see that the Native population is second in case rate. And I don't foresee this dramatically changing in the foreseeable future unless something dramatic happens. But I think where the rates are by race are pretty much going to be the same, same for the foreseeable future. Now, what's of particular interest is obviously not only if people get COVID, but what would be a bad outcome? And a bad outcome would be hospitalizations or fatalities. So looking at all ages for hospitalizations by race, we see the Native population is second in hospitalizations and first, or have the highest fatality rate by race in the state of Wisconsin. Now, like I said, I don't see this dramatically changing unless a particular group starts exhibiting a higher incidence of COVID than the other. But as I mentioned earlier, all the cases, hospitalizations and fatality rates are dramatically decreasing over the last month or two. So now I wanted to bring this up because if we look more closely at age group, in particular around hospitalization. Now this relates back to how the demographics, age demographics of the states have been playing out, where the lower rates of vaccine in the younger population. But as we see in the younger population of 35 to 44, the hospitalization rate, Natives have the highest rate per 100,000. Now, this may not be of any consequence, but I think I've been observing this trend over the last month, and I've noticed that this is going to be the difference between the Native population and hospitalizations and the African American hospitalization is this difference is dramatically dropping or shrinking. 3 weeks ago it was at 14, last week it was 8, now it's down to 4. My sense with this trend that's going on that the Native population may drop down to the second highest rate per 100,000 in the next week or two. That's what I've been observing. That's what I see, at least the trend. That's how the numbers are moving. Looking at vaccination rates. Now, we know that vaccines have a dramatic impact, not only in transmission, hospitalization, or fatalities. So when we start looking more closely at age groups, 18 to 24, the Native population has the second lowest vaccination rate for this age group. Now, what is a little encouraging to this, that may seem bad, but what's encouraging is that the difference between last week and this week is that for the Native population, there's a 21-point increase per 1,000 people. Now, you may not think that's significant, but that is because it's at least showing to me that this age group by race and ethnicity are getting vaccinated. And what I'm concerned about is seeing that nearly all groups are increasing except for the African American community, which only had a 11-point increase. And so this could certainly be a trend that will continue. I don't see the groupings, the rates dramatically changing in position unless a particular ethnic age group dramatically changes. And so this may be more of what we will see moving forward. Looking at the vaccine rates 25 to 34, again, that same that same order. And again, we see that the Native population has increased by 20 points over the last week. And that really coincides with the other ethnic groups, except for the African American community. And when we look at the vaccination rates 35 to 44, we see, again, such a really wide difference between having the lowest rate or the second lowest rate. And this is probably a trend that's going to continue. We see that this age group for natives, 22-point increase, that's 4 points more from the week prior, which was a positive, and really coinciding with the other demographics by this age group. And when we look at vaccination rates of all ages, again, we see the Native category here by all age at kind of the third or right in the middle, and plus 18-point difference increase from the week prior. I don't foresee this changing moving forward unless there's been such a dramatic increase in rate of vaccination. I really don't see this changing moving forward. So one last slide, and I wanted to highlight this because I know I show this, but it's just becoming more and more clear. We know the age demographics, higher rates of vaccine in older population, lower in the younger population. And what this is showing here, what I have circled here on the left, is that in the age group of 20 to 29, almost 16% of all cases in the state of Wisconsin are due to this age group. This age group has had 114,000 cases. And as we go to pan to your right and we start looking at the color-coded age demographics, I put red dots next to the age groups that show the highest number of cases. And this translates into high numbers of hospitalizations. Now, the difference between this week and the week prior is the shift is starting to, at least what I see as a shift. The rate of the percentage of COVID, new COVID infections, is predominantly occurring in the 20 and 30-year-olds. So if you look at the right-hand side on the lower part, the section, 19% in 20-year-olds, almost 20% of all new cases this past week were due to the 30-year-olds. Now, if this is going to be the trend where we start seeing more and more younger people getting COVID, the most likely of sources is going to be the Delta variant. We're seeing that. We're seeing more cases of variant virus strains than the original, and that is probably going to continue to occur. The concerning part is if the younger population is going to be the predominant transmitter of virus with the highest rate of infection, what we're seeing, at least in this 2-week time block, is that now the majority of the hospitalizations are going to be the 20 and 30-year-olds. So this is concerning because we have such low rates of vaccination in the younger population, and now the trend is that most of the infections are occurring in the younger population, which now is translating into more of that population being the ones being admitted to the hospital. So this is a trend that I hope, I hope this all slows to a point of non-existence, but knowing how our vaccination rates are currently, and age groups who are not vaccinated, and we know that fatalities are related to unvaccinated. We know that hospitalizations are related to unvaccinated. It's just a reminder of how important these vaccinations are, given all of the mounting evidence showing how effective these are, in particular against the new variant, the Delta variant. So I'll end with that, Jeremiah. And if there's any comments or questions that you have, or anybody, I'm more than happy to discuss those.
So I had a question actually. So you're talking about, obviously the big question overall is trying to get to that, magic number of 70% for herd immunity. And, I think there's been kind of stories or examples around, our community or our, state of Wisconsin, or, smaller communities of, let's say a city or reservations, or, smaller areas saying, okay, cool, like they've hit 75-80% of, herd immunity. What's your thoughts? So within those small communities, does that really have much of an impact if people are kind of coming and going, if they're leaving to go to, let's say Milwaukee to work, and then they're going back to their community to live? Let's say a city like Cedarburg, they have 70-80% vaccination rates, which not saying they do, I'm just as an example. But then, 50% of them drive to Milwaukee to work, and they're around other people, they go back home. Does that really have an impact, or would it, are you still really trying to look for the overall number?
You bring up a very good point, and it has to be, you have to view this as an overall, if you're going to talk about, you can talk about the town of Germantown, or the county of Dane County, or, that's fine if you want to talk about just that town or that county. The problem is, we know that people aren't static. And what I mean by that is, we move, we travel, we go from city to city, town to town, we go from county to county. So it's hard for you to make a case saying, well, Dane County is at 70%, so we've reached that herd immunity, we're good. Well, that's great if we all lived in a bubble and no one left Dane County. You could make that case. Well, we know that doesn't occur, and so when you talk about, you have to be careful when you start segmenting parts of a population. And so, and it really ends up being, you have to look at it as a whole. And I'm not just talking about southeastern part of Wisconsin, I'm talking the entire state of Wisconsin, because we know this weekend people are going to be traveling from Milwaukee County up north, and maybe vice versa. And people are going to games, they're going to Chicago, they're going to Minneapolis. The traveling is occurring. So it almost becomes a moot point if you talk about a town or a city and a county versus a county, because you're starting to compare apples to oranges, and you can't do that. And so the default is, you have to think about the entire population as a whole. And that's why I try to focus more on the state versus focusing more specifically on a county or a town, because it just becomes harder. So the risk of infection is just as high in a city or town as it is county to county. So the only difference would be is if we all lived static lives and we never left our house, and that would be a different scenario. But that's not the model that we currently operate from.
Thank you. And so I guess stay with that kind of thought process. With rates continuously going down, infections and whatnot, and the current number being what it is as far as people fully vaccinated, do you possibly foresee that maybe there was a underestimation of number of cases that there were at people that had COVID? Because I know at the beginning when we were talking about herd immunity, you're talking about vaccinated people plus people that had COVID. Is there a possibility that maybe overall, there was an underestimation, or, the possibility that COVID was around a little earlier than people may have originally thought?
Yeah, so time's going to tell, and we're going to probably find out that, this the SARS-CoV-2 virus has been around much earlier than even December, probably November. We may find out it's been out as early as September. And so what's the hard part here is actually knowing, and this would be almost impossible to do, but if we were truly to find out what the estimated rate of asymptomatic cases were, we would have to test every single person for the antibodies and basically evaluate everyone to say, hey, did you have symptoms or not symptoms? Did you get tested? Not, and that would be a huge, huge undertaking that would be almost impossible to do. But in this graph that you see here, I don't talk about this very much, but I keep it posted, and it's a regular part of my tally. But if you look to the bottom far left corner, you see 10%, 20, 30, 50. That is the estimation beyond what we know as confirmed cases. So this would be 10, if there was 10% of asymptomatic cases, what would the total case rate be in the state of Wisconsin? Well, it'd only be 12.2%. What if there's estimations as high as 50% that we are unaccounting for? If that was the case, and we add those numbers to the population and the rate that to date, only 16.6% of the state would actually have had it. So, you bring up an interesting point, because how do we calculate that herd immunity when we don't know the asymptomatic portion of the population in this equation? And the answer is it's going to be pretty hard, and you're going to have this pretty wide range of guesstimation of what that is. So if, let's say 30% of the population of Wisconsin, of the cases, 30% were asymptomatic that we know of. So that would mean almost 170,000 additional cases had occurred in Wisconsin that were completely asymptomatic. Now, how would that relate? How do we add that to the current rate of vaccinations? And the problem is you can't, because we don't know how many asymptomatic people have actually gotten vaccinated. Is it half of those people? Is it 80%, 90%, 10%? I mean, we just don't know. And so that's the hard part, because we just don't know, and we're only guessing how much of the asymptomatic are contributing to that overall herd immunity rate.
All right. Thank you, Dr. Nace. With that, so we're heading into a 4th of July weekend. Obviously, we did not, or, it's July 1st. I think July 4th is technically the day we were supposed to hit 70%. We're not gonna hit that. So no free Budweiser, I think, for everybody. But going forward, I guess, into the weekend, I guess leave us with your kind of final thoughts on, people out there. Obviously, you said traveling and, kind of getting together and doing their thing and lighting off fireworks and, partying and whatever. What are your thoughts kind of for everybody for the holiday weekend, and maybe some optimistic
Sure.
points to look forward to coming afterwards?
Yeah. So, I think people have to realize when I give these presentations, I try to give both sides of the coin here. So I try to be optimistic, but I want to be kind of realistic in people's expectations. So the numbers are the numbers, and that's what I go by. Now, this is July 4th weekend. Everyone celebrates July 4th weekend. I anticipate that everyone should go and enjoy the holiday. Just keep in mind of your surroundings and try to mitigate as best you can. enjoy yourself. This is that time of the year where families get together, social functions, gatherings, and do that, and do it safely. And you'll find out that you can have just as much fun as you possibly can without having to worry that this is going to catch up to you. So, and especially if you're vaccinated, there are certainly a lot of liberties that people can take to enjoy the weekend even more. Now, I bring all these points up because, again, as I mentioned, a lot of families are going to be getting together, social functions. And this is really an opportunity to bring up these points, and in particular, points regarding getting vaccinated, because that's really going to be the bottom line. Otherwise, we're going to be continually kicking the can down the road, hoping that this goes away by itself. And it's proving to be very, very difficult to do that because the virus keeps changing. New variants pop up. And so before the summer is over, we do have a good opportunity to kind of squash this virus. And so it's going to be important that people do look and consider getting vaccinated. And I think it's that important, and it's proven to be quite effective. Someone had reached out here and asking how our COVID-19 screening clinics going. We're still open. We still test. We have not been testing at the rate we had been even 6 months ago. So it's dramatically slowed down, which is a good thing because, you know, we're no different than any other health facility here in the southeastern part of Wisconsin. And the fact that we are testing at such a low frequency is a good thing and a good indication that our community that we serve are safe and protected. So thank you for the question. And just as a reminder, have a great 4th of July weekend. Everyone be careful, have fun, and enjoy yourself. I will not be here next week. I'm taking a day off, but I will be returning the week of July 12th, and we'll be looking at how we can adjust our schedules here moving forward, and making sure that I can still offer updated information for this audience. So until next time, stay safe, stay strong, and enjoy the weekend.